A broken nose is a super common injury that, if managed in the right hands, can be managed very easily, or you can go sit in the ER and wait for hours. It's your choice. Now, there are a couple reasons why it is definitely a good idea to go to the emergency room. If you break your nose and you're bleeding and you can't stop the bleeding, that's a good idea to go to the emergency room. But not everyone needs to go to the emergency room because you're going to sit there for hours because it's not a life-threatening injury, and if there's other people in the emergency room that do have life-threatening injuries, that's going to take precedence over your broken nose. The other reason not to go is that you don't necessarily need a CT scan or an X-ray to tell you that you have a broken nose. As a facial plastic surgeon, I can pretty easily tell if there's a fracture or not, and we're going to talk a little bit about anatomy in this video. The first phone call to make after breaking your nose, if you don't have a life-threatening nosebleed, is call your facial plastic surgeon or ENT, and they can probably get you in a lot sooner, or at least get you an appointment, and then you won't have to sit in the ER and wait for hours. My name is Dr. Peter Vila, and I'm a facial plastic surgeon. Going to your ENT or plastic surgeon is going to allow the doctor to see inside your nose and take a look and make sure that there's nothing called a septal hematoma. So a little bit about anatomy. There's a credit card that divides the two sides of your nose. It's a piece of cartilage that goes all the way back and gives your nose that profile from the side. Okay, that's the septum. So the septal cartilage divides the two sides of your nose. In a nasal trauma where the septum might get moved over, it's possible that there could be bleeding into that space between the cartilage and the skin lining overlying the septal cartilage. We call that the nasal mucosa. If there is a bleed inside that space, it will separate out that space, okay? And you can get a bruise, basically a fluid collection of blood inside along that cartilage. If that happens, that's called a septal hematoma. And if that is not taken care of quickly, that can result in you losing that cartilage, which would be a big deal, because if you lose that cartilage, this part of your nose will droop down. You'll get what's called a saddle nose deformity. The other thing that can happen is you can have a perforation or a hole in the septum, because when it heals up, if that's not taken care of appropriately, that can get infected and that tissue can die off, and then you end up with a hole in your septum. It's not necessarily a major issue, but it's something that does take surgery to fix and can be extremely annoying. So if you can avoid it, definitely a good idea to just avoid it. What's the treatment for a septal hematoma? You just drain the blood out, and generally you will put some sort of splint or sutures in to bring those skin edges together on the inside of the nose. And so that's something that your ENT or plastic surgeon can do. Now, if you're doing okay and you broke your nose, there's different kinds of breaks, right? So different kinds of fractures. There are displaced fractures where the bony edges are separated, or there are non-displaced fractures where the bony edges are right up against each other. Now let's understand some of the nasal anatomy. I'm gonna bring in my buddy here. This is a 3D printed skull who's already had some facial fractures that have been fixed. But right here, what you see is that the nose stops right here. The bone of the nose comes to a point, and then it makes this little arch, okay? Now where's the rest of the nose? The rest of the nose is cartilage. That's the squishy part, okay? So the squishy part of your nose is attached to all this bone up here, okay? So when you break your nose, it has nothing to do with the tip of your nose, but it has to do with the bone up here that you see here, okay? So a displaced fracture means that the bony edges are really separated out. A non-displaced fracture looks kind of like this, where you can see a line going through here, and the bone is still, the two edges are still touching each other, but there's just a crack in the bone, just like you might see a crack in the sidewalk. Now, you don't necessarily have to do anything about a non-displaced fracture, other than just be careful with it. So how do we manage a nasal bone fracture? There's generally two different options. The first option is a closed reduction. That really just means that we're not making any incisions and we're just pushing the bone back into place, either using our hands or instruments inside the nose to apply pressure to reduce that fracture. I will then put a splint over that so that it keeps the bone in place and holds everything for about a week, and a week later that comes off. 9 times out of 10, I do that procedure in the office. Now, the most uncomfortable part of doing that in the office is that I do numb the nose a little bit. It doesn't numb it 100%, but it does provide significant help with reducing the amount of discomfort when you manipulate the nose. It is a broken bone, so it can be uncomfortable. And so you numb up the nose and then produce the fracture. The actual procedure itself actually only takes a couple of seconds. It's just to get you there, I need to numb everything up, and that requires a couple shots. If people are super anxious about that, or they just cannot handle that, then we go to the operating room for a closed reduction. Same procedure, you do have to have an IV in place, and that helps you kind of chill out a little bit. And then we do it under what's called a light sedation, meaning you're still awake. Like if I tried to wake you up, you would wake up, but you're chilled out enough that you're basically snoozing. So that's what's called sedation. That's how we do colonoscopies, things like that. And when you are in that space, you're able to have a little more control over patient comfort. And so you get people sleepy enough, and then you can do the procedure. Same exact steps. Reduce the fracture, put a splint on, that's the end of the procedure. Now, sometimes I have to do what's called an open reduction. An open reduction means that I need to make little incisions on the inside of the nose to have even more control over where those nasal bones are going, and I can move things a little bit more and in a little more controlled way. Sometimes I need to do that if we're out of the 2-week period where the fracture happened more than 2 weeks ago and things have started to heal in a way that we don't want them to. And for whatever reason, I can't push the bone back. So then I do what's called an open reduction, and that involves basically finding those little fracture lines, refracturing them, and then moving the bone over. When we do that, same thing, put a splint on top, that stays on for a week, and then generally that's pretty much all you need. Now there is a failure rate associated with that, meaning we can move things back to where we want them, and either it heals a little bit crooked or it just isn't exactly what we wanted. We always have the option to go back to the operating room at a later time to get it back even better. Now, most of the time I don't have to do that, but every now and then that does happen where you tried maybe a closed reduction in the office first, it didn't quite heal the way we wanted it to, so we go to the operating room later on, about 6 weeks later at the earliest, once things have healed into place, and then I can do an open reduction and really put things exactly where I want them. Go ahead and subscribe to that channel if you haven't already, if you learned something new today, and me and this guy will see you on the next video.